Hi, this is Priyanka Goenka, a certified nutrition consultant specialized in fertility, pregnancy, postpartum, and child nutrition. I'm also the founder of the baby food brand Hungry Bumps. In our podcast series of Wellness Whispers with Priyanka, we have a very special guest with us today, Dr. Ira Datta. She is an award winning consultant psychiatrist, a 4 times TEDx speaker, and a mental health ninja. She speaks about mental health and well being through harnessing the power of mindfulness. Thank you so much, Ira, for being a part of my show. It's an honor to have someone like you.
Thank you for having me. It's always fun to do these tete-a-tete, especially about wellness and mental health.
So, Ira, today I want to talk about something really special to my heart, and something very, very sensitive also. The mental health of a woman's life when she is going through the transition phase of preconception to postpartum. So, do you deal with women who are on their fertility journey?
Absolutely, I deal with women who are on their fertility journey, before, after, during, and I also deal with women just with the idea of concept of self-identity, looking for empowerment, looking for understanding themselves, everything around women.
So, how does fertility treatment affect the mental health of a woman?
Okay, I'm not going to get into the specifics of medication. Simply put, because I don't like creating paranoia that, oh, medications cause this and that side effect. Of course, please know anything that you put in your body, naturally also, khana bhi khate ho, usse bhi you can get pet kharab. So anything you put in your body can have good and bad, right? So having said that, yes, medication used for fertility can have great outcomes, which means a baby, of course, but can have negative outcomes as well on your body, on your mental health. But what I really want to talk about is the journey of the fertility treatment. Just reaching that point and accepting that yes, there is a problem and that we cannot conceive naturally. That itself is the first point of mental health. It takes a lot. People live in denial for donkey years. You must have heard from gynecologists that people come so many years into their marriage, 10 years into their marriage, and doctors ask, wait, what's been going on? And they say, you know what, we never thought there was a problem. A lot of couples are also not having sex as regularly, and then they believe that there is no problem, right? Second is the idea, fine, you've gotten started with the fertility treatment, and you're very hopeful the first time around, right? The doctors do tell you that it may take a few cycles. The first time the cycle doesn't take up, the two lines don't show up, there's a lot of grief, there's a lot of disappointment,
It's heartbreak basically.
and that's when a lot of them feel like, give up. एकदम एग्जाम जैसा है, जैसे you give your MBBS MD exams.
I studied so much, I did my bit, I did everything in my power, and still the results didn't come. It was either the doctor's fault or it is just God who did not want things to work.
Or what's wrong with me?
Yeah.
So guilt is another very big part of the mental health challenge, where either the guilt is I'm not good enough, and for some couples it's a blame game. You are not good enough, I'm not good enough. Sometimes for women it's my uterus is not good enough, the baby, if there's a miscarriage particularly. So miscarriage is another mental health aspect during the IVF or the fertility treatment journey that we see, where it's extremely sensitive. Having said that, anxiety is a big part of the whole, oh, I want to have a baby, how will it be, how will the baby be, will he or she get the traits of, and what kind of mother will I be. So anxiety is through and through a part of the journey. Of course, there are depressive phases. Mood swings are very normal. Even in a normal pregnancy, we consider them very normal. But in fertility treatment, we find far more mood swings. Sleep issues are very common mental health issues we see in the fertility treatment. Feeling strange in your body because, going through injections itself is very nerve-wracking for women. A lot of people have phobias of injections, right?
Yeah, of course. And fertility treatments are full of them.
Right. So for them, overcoming that barrier itself, that wait, I need to go get this injection every few days, weeks, months, is just too much as well. And last and most important, the constant need for support of a partner, which you keep looking for during the journey, because the women are the first-hand recipient. Unfortunately, men are not.
But that's the nature's call. That's not something men are doing deliberately, and this is something I come across on a daily basis. When a woman is going through fertility treatment, they just take it so hard on themselves and on their partners that he's doing nothing. But
Yeah.
it's just that much that he can do.
But he can show up. He can
Yes.
have a lot of support, because
Yes.
a lot of men come in the fertility treatment journey of their wives and they say, what can I do to please her? What can I do to make it better? I can't sit all day at home. I can't go get the injection myself. A lot of men have said, I wish I was a seahorse, because seahorses are men. The men carry, the male carries the baby. But yeah, there are a lot of men with a lot of intention of wanting to help their partners. So yeah, that's how the journey of fertility treatment looks like, without the medication being the target of our conversation.
As I come across a lot of women struggling, really struggling with mental health, like you mentioned, anxiety, depression, phobias, there's a lot going on inside a woman. So, do you think therapy can help them get to their goal a little better?
Therapy is not a magic wand. The idea is first realization, acceptance, going through the motions, and then yes, it may help you. So, a lot of people come to therapy with this idea that going to therapy equals to directly reaching your goal. Often you go to therapy saying, you know what, I'm here for this. You'd be surprised how many people don't reach that goal because, sorry to say, that wasn't the ideal goal for them. They were believing that was the right thing for them to do. So we turn their goal, and then eventually, yes, if we can come back. So many people come and say, I have sleep issues. And then we explore. Like, sleep is not even the problem for you. Anxiety is the problem for you, right? Your lifestyle is the problem for you. How you are dealing with your day-to-day problems is the problem for you. So we keep changing based on the needs. Yes, you can learn the tools to keep getting to your goal rather than just learning the direct one-way street.
So, I agree with you. People, when they come to us for diets, for fertility diets, so they're like, I'm doing this, I'm taking the medicine, I'll be on a healthy diet, and then there's nothing that I'm not doing, so I have to reach here. And if I don't reach here, then that means I am not at fault. A lot of people come with that notion also. To me, I've seen that. So is that the notion that you get from your clients as well?
Oh yeah, also because mental health is not even measurable.
Yeah.
Fortunately, at least physical health is measurable, right? You can do inches, you can do weight, you can do BMI, you can do fat percentage, you can just
Yes.
conceive a baby and say, okay, there you go. So yeah, all the time. People don't want to understand the nuances. They want just, maine apna kaam kar diya, I'm done with it.
Yeah.
All the time.
Correct. Okay. So, as we know, there is a lot of talking about people struggling with fertility and their mental health. There is definitely a lot of people talking about postpartum, depression or postpartum blues. But pregnancy is somehow considered to be a happy phase always. But I have been through it. I know a lot of women have been through it. It's not always a happy phase. Your end result is the baby. You're looking forward to it. You are happy in a lot of ways, but then there are a few women I have seen who really struggle. And can you highlight a little more on that?
So I think the society has really conditioned us to believe that
That-
you need to be happy.
Exactly.
And that is why when a baby is born, everybody presumes you are very happy. Of course, our generation is trying to change this narrative. At the same time, for a lot of women, it is actually super easy, and that's great. So we don't always have to consider that for everybody it's going to be hard.
Exactly. There is like no one size that fits all, no one diet that fits all. Everything has bio individuality. Then why is pregnancy considered to be a stage that it has to be a happy phase? Though how can a woman not be happy in this phase?
But Priyanka, see, for everything, that's the notion. तुम्हारे marks अच्छे आए हैं, you better be happy. You've come first, you better be happy. You've come second, you better be happy, right? You've lost weight, you better be happy. So, in a way, we are constantly shaming people for not being happy or grateful. Often, women who have babies, who've just delivered, are told, oh, why are you not happy? At least you have a baby. So, that kind of shaming makes one doubt themselves that, wait, am I wrong somewhere? And that is a narrative we need to start changing, rather than asking a new mom the next time you go to see a new mom that, oh, you must be so happy. Just say, how are you feeling?
Yeah.
And that could be just the start of a new age conversation, saying that, I am not feeling good, I feel like crying. Rather than saying, yes, I'm very happy. And if she's happy, great.
Nothing like
Right?
it.
So don't put pressure for you have to be happy, right? A lot of mothers have very difficult antenatal journeys. I've had patients who've lost a parent during being pregnant. So hard, right?
So hard.
You are
So-
expected to be happy, but you're grieving. I've seen couples fight a lot more during their pregnancy journey. So you've had a fight with your partner, expected to be happy. I've seen people not like their body changes.
Yeah.
So you're expected to be happy, but then you're hating the way your body's
Body is
looking.
looking
I've
and
seen
shaping.
people give up promotions at work, women, right?
Mm.
They were due for promotion, they had to give that up. Be happy, but wait, my promotion, I've worked so hard for it.
So, Ira, do you ever notice a connection between diet and mental health?
Like you were saying, everything is diet. Yes, absolutely. You eat yummy food, and your mood becomes good. अगर घर में टिंडे बने हो, करेले बने हो, your mood goes down, although it shouldn't, of course. So yeah, food has a very big impact on your mood. You eat greasy food, bulky food, you may feel happy in that moment because your dopamine spikes, but in the aftermath you may feel very sluggish. Similarly, if you're not getting enough nutrition of a certain kinds, it does impact your mental health. So yeah, food and diet, overeating, emotional eating. There's so many eating disorders for that matter. Undereating.
Size
Yes.
zero, getting to that perfect
Yes,
body, all
yes.
of that.
Eating disorders, everything is related to food and mental health. It's a very big chunk of who we are, because if you think about it, if you put food in front of you, why do you eat? So you look at the food and your brain gets this message that, okay, this is something edible. The smell tells you, okay, let's do this. And that's when there's a response in your brain which says, go for it, right? And you start eating, and satiety then starts kicking in. That is why we all aim for satiety. And yeah, food and mental health will always be integral to every bit.
So, as a nutritionist, I have often noticed that emotional eating is somehow connected to mental health. What's your take on it?
Yes, and in fact, I think it's a pandemic out there right now with Swiggies and Zomatos, and you can get what you want whenever you want. I'm craving a cheesecake, I'll get a cheesecake right now. So, whenever a patient talks about their emotional eating issue, which is very often, I would say, just the other day somebody said that they opened their refrigerator in the middle of the night and they saw some desserts and they went for it. And I said, what led you to eat it? And they said, I was already awake. Anyway, I couldn't sleep. So I thought, maybe I'm hungry. And if I'm not hungry, at least my mood will get better and then I'll sleep. So, just talking yourself into that, just listening to your emotions at that time, or maybe, when you're around your PMS, when you have carbs craving.
Ask me about it.
Yes, carb craving is very, very genuine at that time. Similarly, some people, when they're feeling down, they want to order a greasy meal. I, for that matter, think about pizza once a day, but I eat pizza maybe once in 3 to 4 months. So I think about it every day. But then that's how I like to train myself, saying that just because I'm thinking about it doesn't mean that I have to land it on my plate. What can I do? Can I remove the cheese? Can I remove the base? Can I have just the salad part of it?
Yeah.
But that's something that we all need to learn to, first of all, the moment emotional craving hits, don't answer it immediately, is always my response to anybody who struggles with emotional eating.
But sorry to cut you out here. I know someone very, very closely. I've been working on someone very closely, and that person, that woman, she can't just control herself. Like, one day, I know, out of guilt, she called me in the middle of the night. She ordered a pizza, finished that entire pizza, one woman finishing that entire pizza, then ordered a cheesecake after 15 minutes, then something from another restaurant. Back to back, she ordered 4 packages, finished all of them. She couldn't understand why she wanted to eat so much, because honestly, no human is so hungry, and after a certain point, you're not even craving, because once your satiety levels kicking, you are not even hungry, or you're not even craving, but you still want to eat, and you can't control yourself. mentally.
I'm sorry, you're not craving anymore, but now you're guilt eating.
Yeah.
So what happens after the craving comes down? Your realization kicks in. Oh my god, I'm guilty, I've eaten so much. And now to douse the fire out of the guilt is when then another vicious cycle starts. So compulsive cycles begin like this.
So that's when you mention that I tell everyone to train their mind like that. How does one train?
That's exactly what I was getting, that you do not train yourself to not order. You train yourself to wait for 1 minute. Next week you train yourself for 2 minutes. The week after you say 5 minutes. You know what? I'm really feeling like ordering a pizza. I'm not gonna order for the next 5 minutes. Here's my timer. Here's my phone away from me for 5 minutes. Let me see if I can live 5 minutes without it. Is it possible maybe I can live 10? If you can, please go ahead. There's no point guilting yourself either, right?
Yeah.
So between the spectrum of giving into your cravings and feeling guilty about it, there has to be a middle ground. And that comes from, like I said, training. You and I don't go to the gym and pick up like 95 kg first day, right?
Of course.
So we pick up 1, 2, 5, 10, right? So similarly, you wait it out for that tiny duration and you pat yourself and say, reward. Alright, you know what? I waited for 5 minutes today. I deserve a slice of pizza. I waited for 10. I deserve 2 slices. No problem. But the whole idea is you train yourself. You do not ace the mountain in one day.
Yeah. So in simple terms, like you train for everything in your life.
Yeah.
It's the same
You
way
practice.
you train your mind. Practice
Absolutely.
makes the man perfect. Okay. So here now jumping into postpartum. Like, does every woman face postpartum blues? Postpartum depression, I know, is a heavy term. Let's get there a little later. But what's your take on postpartum blues?
About 80 to 85% women do. So it starts within 3 days, lasts couple of weeks max, and weans off. And that is normal because, so there's a chemical in your brain called alpregnolone, which basically comes down after pregnancy, after the delivery, sorry. And that is why the brain is now very sad that this happy chemical was there. Oh my god, it's going. So your brain is crying, which is very normal, and that's the postpartum blues, right? Just like when India lost the World Cup, we were all very sad for 2 days.
So it's like it'll last for a small period of time and fade off on its own.
Correct. Plus, it will not be disturbing to your day-to-day activities. There are no suicidal ideations in that for sure. And there are moments of flickering happiness. What people don't talk enough about, in my opinion, is not just postpartum blues and depression. I think there's plenty of people talking about it. The 2 things that people don't talk enough about, 3 rather. One is postpartum anxiety, which is very real and which is more common in my opinion than even blues. Postpartum OCD, which women are too embarrassed to talk about, and postpartum psychosis. So, which is a very medically important thing for us as psychiatrists to treat. But postpartum anxiety is so relevant. I think any new mother watching this will relate to it, that you know when the baby is sleeping and the baby hasn't woken up and new baby sleep for 20 to 24 hours. Wow. So you're like, is the baby okay? Is the baby breathing? So there are watchers.
Always checking on the baby.
Yes, not giving the baby to anybody because of the germ phobia, right? Oh my god, somebody is going to touch them with dirty hands. Not letting people alone with your baby, not leaving the baby alone even when you go to pee. Postpartum anxiety is not talked about enough, in my humble opinion. I think we all relate to it.
Absolutely, absolutely. Ask me about it so much. Now that you mentioned, I can relate to so many things back then.
Correct.
And it's so untouched. I haven't heard anyone talk about postpartum anxiety at all.
Yeah.
Ever.
Yeah. But more and more moms come with it because they come thinking they are in postpartum depression or they have blues. And when we talk, we realize it's not either of those 2, and it's anxiety or it's something else.
And what is that one mantra to deal with it?
There can't be one. That's unfair, no?
Yeah.
There's like a magic trick then. But for postpartum anxiety, of course, you need a lot of reassurance, you need a lot of education to the mother. That's why new pediatricians need to work with moms and tell them what is normal for the baby at that time, what is not normal, not to worry about lactation. Again, part of postpartum anxiety, I would say so many moms freak out about the amount of milk they produce. They think they should produce like itna sara milk from day one. No.
Training.
You start from here. You start from here, and the milk quantity increases by 3rd, 4th month. You're like, so much milk left over. Let's stash it, right? Let's put it in the fridge. So these are things because of lack of information in the past that was the problem. Also the overgeneralization that from day one, age old tale was, oh, we used to have so much milk, why aren't you having milk? Nobody had that much milk on first day. So these things need to be educated to new mothers, and that's how we get better.
Is there any way that just not the mothers but other people in the family can get educated? Because it's a lot of pressure that people put on the mother, especially new mothers. Mom guilt is very real. Very, very real. I think even being a mother to a 7-year-old, I still have mom guilt inside me. Till date, I struggled with it so many times. So many times in a day, not even. So, and I have realized that initially it's the people who put a lot of pressure on the mother, and they just make sure that the mother is guilty somehow or the other.
Is that really their intention?
What is the intention then?
People take their anxiety and they dump it on others. That's their only intention. It is not to make anybody feel guilty.
So
people are just displacing their emotions. They don't understand their emotion. Oh, it's too heavy for me. Let me just pass it on to this person. But when you asked, is there a way to educate everybody else? No, we don't live in a utopian world. Not everybody has to be super informed and educated. The power of knowing for a new mother is that she can hear a lot of information. She can sieve and filter through, and she can do what is right, even in the confines of her room. Trust me, even if somebody's watching, or even saying that the doctor has taught me this, because most people back off the moment you say that my doctor has said this. So let's not hold our breath for the world to change. Let us be the change, rather than saying, oh, all the mother-in-laws, all the husbands, all the extended family needs to change. Let's just start with us.
Correct. Absolutely correct. When we talk about postpartum depression, what are the red flags that one must look out for?
For postpartum depression, number one, the gravity of the situation is big. The mum is low, irritable, crying most days. She definitely does not feel a connect with the baby. Suicidal ideations are super common, or the idea that I want to just leave the baby and go away. At the same time, biological issues are there, like sleep and appetite are disturbed. The mother may also have a lot of guilt for no good reason. Even, oh, I can't feed the baby, could be a very big guilt.
Very big.
We also look for it bordering on postpartum psychosis, which is, what if the mother has started harboring thoughts that this is not my baby, or I want to hurt the baby, or I want to hurt people around because they're going to hurt my baby. So we look for those also, especially psychosis. Look for a bit depression as well. Till you don't ask, you don't get the answers.
Yeah.
And at the same time, there's a very stark difference in the person's baseline personality. This may be a person who was happy-go-lucky earlier and has become extremely aloof and low. So for depression, we have some pathognomic signs lasting for at least 2 weeks or more. But again, depression comes in small, medium, large. There is no one-size-fits definition for anybody, meaning like not everybody will present with severe depression. Most people will present with mild to moderate postpartum depression. So some days will be okay, but then again they'll come back and they'll say, I'm still feeling like that, I'm still feeling like that. It can go on for months, it can go on for a year, for new months, unanswered.
So there's something that I have heard from a lot of people. Mothers feel the loss of connection a lot of times. Loss of connection with the partner or with anybody around. There's a huge, loss of connection with self also a lot of times.
Absolutely.
So does that happen, and is there any way to feel better about it?
Yes, there is the most common complaint that new moms say. You know what, doc, I hate to confess, but I'm jealous of my partner that he gets to go out and I get to stay in all day. I'm jealous that, my body is very different and his body hasn't changed. And there's a lot of animosity at that point towards the partner. Very, very common, right? The loss of connect with friends who don't have children because they're all partying and celebrating.
Yeah, you are on a different point in life, and your priorities change overnight.
So there is certainly a loss, and if you think about it, loss of the old body, the loss of the old self, the identity. But the only way to heal is through a journey there is again, if you want to run away from this new role towards that old role, that's not going to happen. Just like your uterus has gone this and then gone back, but it does never becomes that baby uterus
Yes.
ever. So it's just the same way. You have to accept a big part of it, wait for a lot of it to pass. I tell a lot of new moms that, hey, the good news is the hardest part is over. Now we're going to look at the better part. And they say, wait, this seems harder. I say, yeah, every time it's going to seem harder. I'm going to say this every time to you. And they laugh. By the third, fourth time, they hit themselves and say, oh, are you going to tell me the hardest part is over? I'm like, yes, it is.
Basically, a journey of acceptance. What is the role of social media in the current mental health scenario?
For the mummies, for the new moms,
For the new moms, but yeah, for everyone in general also.
let me focus for the new moms because we're talking so much about new moms at the moment. I think social media is good, bad, and ugly for new moms.
Yeah.
I'll tell you why. Good because they get a lot of information from social media.
Yeah.
Like a lot of moms to feed the baby, what is the right temperature of the
Yeah,
milk.
things not to do. There's a
Absolutely.
lot of information out there. You
Yeah.
can use it.
For the good. After the good definitely comes in the bad. The bad is too much information, too much misinformation. Very gently
Yes.
saying that. Too many self-proclaimed pundits and gurus out there. And the ugly is the comparison because social media is so comparative. Oh my god, that mom's lost all her postpartum weight. I still haven't. Look at that baby's postpartum shoot, and my baby is not looking the way I'd want them to, or I couldn't do a shoot for them.
Or a mother doing something for the child and saying, I'm such a bad mother, I can't do this.
Or
This
going for a
comes to
vacation
you.
and saying, oh my god, mujhe nahi leke gaye vacation
Yeah.
pe. So yeah, good, bad and ugly, all three are there, and for everybody for that matter, but specifically for postpartum mothers, this is a big part.
Huge chunk.
Hmm?
And do you think that we all in general, even moms, new moms, they just kind of absorb a lot of negativity from social media?
Everybody does.
Yeah, people are kind of absorbing more negative than the positive from social media. Is that so?
Depends what you consume, obviously. If you're watching stuff which is going to be toxically positive or it's going to be far too unrealistic, yeah, you're going to feel more negative. But yeah, you can have things that you consume in moderation. Also, create more than consume is always a mantra that I tell people.
Yeah.
So then it can actually,
So when
it's a
you
livelihood
say
for
create-
people. I don't want to say that it's only
Yeah.
absorbing negativity. A lot of people live
on
social media.
media.
On and off social
Off
media, like they live from social media's money,
Correct.
right? So nothing wrong with that. They're creating, they're spreading a good message out there.
So everyone is talking about how important sleep is, be it a nutritionist, be it doctors, be it mental health pro. So Ira, there is a lot of emphasis around sleep nowadays. Everyone is talking about sleep, how important it is. So and how is sleep and mental health related?
If there's one advice that I could have given my younger self, it would be sleep more. And I already sleep enough, I believe. But even during my exams, I remember while others would be toiling and studying and everything, I used to make sure. So an average medical student gets maybe 2 hours of shut-eye in the night before. I was the only guilty one to get 5. And everybody would say, how are you doing that? I said, boss, if I don't do this, I'm not writing a word tomorrow, right? So for me, I love sleep. I prioritize sleep and I help people sleep better, of course. But what we are fundamentally getting wrong about sleep these days is that because of devices,
People are
really
sleeping really late and they're preoccupied with their devices and
Yeah.
they spend a lot of time on that.
right. So the problem is in your pocket, and you are looking for the solution in the pocket itself on the phone, right?
Yeah.
Now that's one fundamental problem. The other fundamental problem is also the whole idea that there used to be a set routine in the past. Lights off, ho jata tha. The TV used to not play anything after the night. Yeah. And we would just get into bed. If families had routines, completely gone for toss. And the third is we're not getting enough sunlight in the morning, which doesn't reset your circadian rhythm again. So these are 3 important things that I tell people. If you can manage for 21 days, 30 days, you're going to be on a better path. That's one. The second part that you said, that how important, how is it linked to mental health? Well, everything around sleep and mental health are related. So many diseases, you see sleep going for a toss, whether that's depression, even in anxiety. Sometimes people sleep too much. That is also a problem because then you still feel very sluggish. You don't wake up very fresh,
the
right?
hormonal imbalance is basically that happens due to lack of sleep.
Correct. So sleep and mental health are definitely, sleep is one of the biggest pillars of mental health.
So, is there any one mantra, again, if I may ask, that you would give one suggestion that people can sleep better? Then what would it be?
Don't run behind sleep, let it come to you.
I'm someone who's actually trying to. So I have a friend who's been calling me that I can't sleep. I'm on pills. I'm on antidepressants. I try so hard. I switch off my phone 2 hours before. I'm in a dark room. I'm sleeping alone so that there's no disturbance. But I still don't sleep the entire night. I'm awake and I am so desperate to get that sleep. How do you help people like that?
You said the exact word which I said the answer to. I'm trying so hard.
Yeah.
So I said, don't run behind sleep, let it come to you. If you are running behind sleep, you're basically not in bed and you're running behind in your mind or physically, whichever one it may be. Let the sleep come to you, which means you focus on relaxation. You don't focus on running.
How to sleep, if I'll get sleep or not. Don't get anxious over sleeping. Just go to bed like you would normally always do and see how it works. Is that what you're saying?
I'm saying don't run behind sleep because the whole antithesis is that what you're trying to get so hard, it's running away from you. So one fun thing that I tell people who say हमने सब try कर लिया, everything under the moon, I don't believe it, because when people say they've done everything, I truly believe they've not done even one thing properly.
Yeah.
If that was true, then for diet we've all tried to lose weight. Everything under the world I've done, right?
Yeah,
but nothing works.
Yeah, that too, I agree. Now I understand what you're saying, because when you connect it with diet, I understand when people say I've done everything, but
they've not done one thing properly. Correct.
Probably they want to be in that space.
Yes. So I tell people, okay, how about a challenge? And they say, what? Tonight? Don't sleep. Don't sleep. They say, what kind of rubbish challenge is that? I've come to you because I can't sleep. And I say, yeah, you're trying so hard. I'm taking the trying hard part away. You remember what would happen when you would study back in school? You would try so hard to be awake, we would fall asleep. So go, tell that friend, please stay awake. And she'll say, what kind of rubbish advice is that? Say, well, a psychiatrist said don't run behind sleep, let it come to you.
Perfect. I think that makes a lot of sense. Okay, so who is a psychiatrist and who's a psychologist? What is the difference? And the new mothers or women struggling with fertility and women in their pregnancy phase, whom should they first consider going to?
Why don't you first tell me the layman understanding of who is a psychologist and who is a psychiatrist? I like to ask people this question because this is the most over-answered question by me.
I will honestly tell you, forget about what I think, but I want to tell you what people have come across. Tell me.
Sure.
Psychologist is someone you'll go to who will counsel you, listen to your problem and give you solutions verbally. Psychiatrist is someone whom you go to, and usually I'm telling you what I've heard from a lot of loved ones. They do not want to go to a psychiatrist because they'll be put on pills. This is a common myth, I know for sure, that people have in mind. So this is the major difference they've always come across to me.
I hear you, and I do agree. A lot of people say that. When a patient goes with high blood sugar the first time to a physician who's a doctor, psychiatrists are doctors, same as MD medicine, they're MD psychiatrists. Do they immediately put them on oral hypoglycemic agents? No. They say go to a nutritionist.
Yeah, get your blood levels down.
No. That is a doctor's job. You're mixing the two. I'm saying the physician does the tests, physician does the diagnosis, physician does the options. Hey, we can put you on medication, or you can improve your lifestyle. You can go to the nutritionist. Similarly, a psychiatrist does not put you on pill the moment you walk in. They do exactly what a physician does for your blood sugar. They evaluate you. Nutritionist first.
Yeah.
They're first giving you insulin, right?
Exactly.
They're not even giving you medication. They're not giving you tablets, right? Similarly, a psychiatrist assesses, diagnoses, offers treatment choices. Now, what are the treatment choices? Okay, it's very severe, like high insulin, level thing, high blood sugar level. Let's start medication. That's one option. Second option is, okay, you know what? It's oral hypoglycemic agent kind of sugar. Let's start antidepressant like this, but always combined with a nutritionist and physical exercise. And that's the parallel I want you to think. Psychologists are our right hand and our left hand. Essentially, they do assist us in providing therapy, in taking care of a more regular approach with the patient. They don't provide solutions. Nobody provides solutions. Solutions that will be found within, right? They help you being answerable. How you take responsibility. That are you taking care of yourself or not? So yeah. So this age-old myth comes from the fact that back in the day, there were not enough psychologists, there were not enough psychiatrists. So people would automatically then presume a lot. Also, going to the mental health specialist itself is a very big taboo, right?
Exactly, in the society, which is getting lifted now. But
and you'll be surprised. Psychiatrists do therapy themselves as well. A lot of us are trained. Some of us don't want to continue the training. All of us are trained back in medical school, in fact. But yeah, some of us don't choose to, just because. Similarly, there are maternal mental health specialists, meaning there are psychiatrists who are maternal mental health specialists. They deal only with anything around maternal health. Not that other psychiatrists can't do it, but sure, they are super experts in it.
Yeah.
And similarly, there are psychologists that you can go to, and they have excellent information and excellent way of counseling. What I think who you should go to first, if you are under a fertility plan, and if you're undergoing IVF, the best thing is most gynecologists these days have a team of counselors and psychologists already as a part of their team, because a bit of counseling is mandatory. So that is your first step, always your first step when it comes to fertility and mental health, around maternal mental health. And then if the gynecologist believes that, this mother is particularly going through postpartum depression, or this condition is far more severe, or this person requires medication during the IVF treatment, they will always send to a psychiatrist for review. That's how it works in most cases.
Okay. Thank you. I think that was an eye-opener again. A lot of people, because there is a huge taboo in the society, that definitely is, and between psychologists and psychiatrists, people are still of the mindset that they don't want to go to the psychiatrist because of the pill part.
Some of my closest friends are psychologists, and we have a good chuckle that how society tries to pit us against each other, psychiatrists versus psychologists. The reality is we work very much together, because on a day I probably refer 4 or 5 patients out to a psychologist, and on a day they refer a couple of patients to me from their practices, because they recognize that they've been doing therapy for a while and the patient's not going anywhere, and they say, you know what, doc, you need to take a look. So I think it's a union rather than saying this or that. It's this and that, right?
Yeah. I think if the world understands this concept in most of the things, because this is what is happening everywhere in every field, then the world will be a better place for sure.
Yeah, until that time we can only try.
Yes,
Definitely.
exactly. Okay, there is a question that I have in mind. When you just mentioned self-love.
Did I? When?
Are you taking good care of yourself or not? That's a checklist that you mentioned. So I am a very strong believer of that. Anyone who wants to really change their life the way it is, or people are really struggling in doing things better, working things out better for themselves. So I very strongly believe that you have to start doing things for yourself, and that only happens when there is self-love, right? You start taking care of yourself. You do things. Why would you do anything for anyone in that matter? Not just for self, but for anyone. Because there is a certain amount of love that exists, right?
I'm not the biggest fan of self-love.
No? Why?
Again, I think we've glorified it so much that we dismiss a big chunk of population who can't have self-love for themselves for so many reasons. It's like expecting that everybody has 2 eyes. It's that kind of presumption. No, everybody doesn't have 2 eyes. Everybody is not equally abled. There are a lot of people from diverse
backgrounds.
So that's
and-
why I find the idea of self-love a little pop psychology.
But by self-love, does it mean that you have to go out of your box and do things? But
That's what people think.
Yeah,
That's why I don't like the
exactly.
concept of self-love. Because there's pressure on self-love.
Yeah, self-love is just doing the basics, like even going out in the sun and taking those 10 minutes out for yourself is self-love.
Again, that's why I don't want to call it self-love, because let's call it something like a basic fabric of, or let's even call it a chore. For some people, somebody who's depressed, it's a task to go and get that. You can't just shame them and say, you know what, you don't have self-love, that's why you won't go get the sun. अगर ऐसा होता तो फिर depression ही नहीं होता, right? That's like saying my leg is broken and all of us can walk,
But
and why am I not running,
running,
right?
yeah.
So that's why I find the term tad bit pop psychology. But I get what your intention is. Your intention probably is, and you can finish your question after I explain the intention, that do you mean that we all need to have some kind of belief in ourselves to begin to do something? Is that where you were coming from?
Yes, my question was basically that, again, from the perspective of new mothers and pregnant women and all that there's a lot of societal pressure any which ways. So breaking through it, or just doing things for yourself, creating boundaries around yourself where you believe, just things that make the smallest of things, that might be anything. Eating a meal just by your choice also can be a form of self-love, is what I'm talking about.
Okay.
It's not, I'm not saying that going that extra mile, walking that extra road and thinking of making it a big thing. Self-love is self-love, just loving yourself and doing the most minimal of things. That's what I'm talking about.
Okay, sure, right. So